Hello, our names are Hannah Obregon,
And Emily Jordan.
and we will be presenting our research on the dual delivery of Y15 and Metformin in a PLGA scaffold for the treatment of platinum-resistant ovarian cancer. So in the US, ovarian cancer is the fifth leading cause of cancer mortality among women. This poor survival is linked to the late detection of the disease and the development of resistance to chemotherapy with platinum compounds. As much as 70% of patients with advanced stages will have reoccurrence due to platinum drug resistance. Despite this, there is no standard treatment for platinum-resistant ovarian cancer. Thus, alternative treatment methods need to be investigated. Y15 is a focal adhesion kinase inhibitor, which increases the cancer cell sensitivity to chemotherapy. Metformin has been found to have anti-cancer effects and induces apoptosis in ovarian cancer cell lines. Biomaterial scaffolds can be utilized to deliver drugs locally to maximize the drug concentration and bioactivity at the target site while minimizing non-target systemic exposure and toxicity. PLGA is a biopolymer which is highly biocompatible and versatile, with its degradation rate able to be tailored from days to years.
The objectives of this study were to first utilize biomaterials as a drug delivery system and investigate if the combined delivery of both drugs would result in synergistic effects on cell viability when compared to the release of each drug alone. Second, to investigate if scaffolds could provide a controlled release of the drugs of interest. We hypothesized that the use of PLGA scaffolds would increase synergistic effects on cell viability compared to the release of each drug alone. We also hypothesized that the use of the biomaterial scaffolds would prevent a large release of the drug at once and provide a sustained release over time.
PLGA scaffolds were fabricated from an easy and economical moldless technique by combining PLGA and the drugs in tetraglycol and injected in PBS to form a globular scaffold. To determine cell viability, we used an MTT assay. OVCAR3, a platinum-resistant ovarian cancer cell line, was exposed to different concentrations of the drug or release solution, and an MTT assay was performed by determining the absorbance at 570 nanometers with a spectrometer. Release kinetics was determined using 3 similar weight scaffolds for each drug used. The scaffolds were then stored in a microcentrifuge tube and submerged in 1 milliliter of phosphate buffered saline in a non-CO2 incubator at 37 degrees Celsius. Scaffolds were removed and placed in new microcentrifuge tubes containing PBS for the time points 1, 3, 7, 10, and 14 days. The drug concentrations were determined using a spectrometer to read the absorbance at wavelengths 233 nanometers and 380 nanometers for metformin and Y15 respectively, and both for metformin and Y15.
Now we can move on to discussing the results of our study. Starting with figure 1, we can see that cell viability of OVCAR3 cells decreases with increasing concentrations of metformin. The half maximum inhibitory concentration, or IC50, for metformin was 8.974 millimolar. IC50 measures the potency of the drug and determines the concentration needed to inhibit cell viability by half. Our IC50 was calculated using the program GraphPad. In our cell viability assay for Y15 in figure 2, we can see a similar decrease in viability as concentration of the drug increases. However, the IC50 of Y15 is much, much lower at a concentration of 4.786 micromolars. This means that metformin needs a concentration 2,000 times higher than Y15 to induce 50% cell death. This is due to the fact that metformin is traditionally an anti-diabetic drug and has been repurposed for cancer treatment due to its secondary anti-cancer effects. In figures 3 and 4, cell viability assays were used to determine the effects of the combination of metformin and Y15. In figure 3, we can see that a concentration of 10 millimolar of metformin causes a cell viability percent of 44, and a concentration of 4 micromolar of Y15 causes a 76% cell viability. In figure 4, the concentration of Y15 increases to 5 micromolar with a corresponding decrease in cell viability to 30%. The combination of these two drug concentrations results in a synergistic effect, and the cell viability decreases significantly to 20% for figure 3 and 13% for figure 4. In figure 5, we see bright field imaging of our platinum-resistant cell line, OVCAR3, when treated with each drug alone, in combination, and when compared against nothing as a control. Starting with our control on the far left, we can see a confluence at or near 100%. The next image has far fewer cells, with some larger colonies we could see when it was treated with metformin. Next, the Y15 treated cells show a high confluence as well. This is due to the low concentration of the drug use, as we saw in figure 3 with the full micromolar of drug use. Finally, on the far right, we see the cells treated with both metformin and Y15. In it, we can see the synergistic effect described in the previous figures, as much fewer cells are viable, with no large clumps like we saw with the metformin-treated cells. In figure 6, we can see the fabricated PLGA scaffolds loaded with our drugs of interest. All 3 scaffolds were successfully fabricated with globular, smooth, and non-porous morphology. Since these scaffolds formed this way, they should be resistant to a large release of the drugs at once. In figure 7, we can see OVCAR3 cells treated with the released media of the different scaffolds. We can see that the half-diluted and undiluted releases of metformin and Y15 had cell viabilities close to 100. However, when combined, the half-diluted release produced a significant decrease to 23% viability, and the undiluted release had even less at 5% viability. Finally, in figure 8, we see the percent of drug released from the scaffold over 14 days. We can see that by day 1, less than half of the drug is released, meaning that a burst release was avoided. Then we see that over the next 13 days, there is a controlled release with a steady increase in the total percentage released.
All in all, the use of metformin and Y15 in biomaterial scaffolds seem to be a promising avenue for the treatment of platinum-resistant ovarian cancer. Not only does it result in a synergistic effect on platinum-resistant ovarian cancer cell lines, but when utilizing a scaffold, there is a controlled release. In the future, we will determine the drug loading percent and efficiency in addition to release kinetics for the Y15 and combination fabricated scaffolds, and performing a Western blot to determine protein levels for apoptosis factors. We would like to acknowledge support from the UTRGV Engaged Scholar and Artist Awards. Thank you.
Thank you.